Okay, please take your seat. Okay, let's start. Good morning, fellow Lions.
Good morning.
Good morning.
I'm District Governor Dr. Jun Valera of District 4C4, the servant leader of District 4C4, which covers San Francisco, San Mateo, and the city of Palo Alto. So we are going to present to you today a very exciting, relevant topic, service project during COVID-19 pandemic, which is the Drive Thru Clinics. That is the first part. I am the presenter on this. And the second part, which is also very, very important, is introducing our new MD4 endorsed program, the Global Initiative for Health and Wellness. And the presenter for this second part of the program is Dr. Eleanor Britter. Please stand to be recognized.
Yay.
And of course, Lion Fred Cohen will speak on the Global Initiative for Health and Wellness Education. So let us proceed. Service project during COVID-19 pandemic, Drive Thru Clinics. And again, I'm the presenter. So let's start with the history of 1918 flu pandemic. There was no universal consensus on the location where it started, but they said that it's avian in origin. Avian means birds. It was identified in military personnel in spring of 1918. Take note, 1918. Something's going on in 1918. That was World War I, from 1914 to 1918. There were 500 million people affected, and it's 1/3 of the world's population. There were 50 million deaths with 2% case fatality rate. Just compare this to our COVID-19 pandemic. COVID-19 pandemic is a minuscule of this flu pandemic. 50 million. There were 675,000 deaths in the United States. And the age bracket with highest mortality are the younger ones, 20 to 40 years old. And during that time, take note, there's no vaccine. We're lucky we have already vaccine. Vaccine was developed in 1930s. And what happened during that time is non-pharmaceutical interventions, such as isolation, quarantine, good hygiene, limited social gatherings, and disinfectants. That's what we're doing right now. So let's go to the history of flu vaccine. Influenza A was isolated in 1931. Influenza B was isolated in 1940. Flu vaccine was developed in 1938. The large-scale flu vaccine manufactured in 1945, and the trivalent and the quadrivalent vaccine developed. Trivalent means it is effective on B, influenza B, and two types or two variants of influenza A, which is H1N1 and H2N2. Quadrivalent vaccine means the effect is on two types of A and two types of B. However, virus keeps mutating, producing different strains frequently. So the effectivity of vaccines changes from time to time. Let's go to the flu statistics. That is 2019 to 2020. This is the CDC estimation of flu burden. 38 million people get sick. 18 million people visited their healthcare providers. 400,000 hospitalized. 22,000 dead. And let's go, this is the current U.S. flu season preliminary burden estimates. This is only October 1 to January 29, 2022. 2 million to 3.6 million with flu. 1 million to 1.6 million visited their healthcare providers. 21,000 to 42,000 hospitalized, and 1,200 to 3,500 died. So that is our current flu burden. So let's go to flu vaccine statistics. It will only give you 40 to 60% reduction in flu if you receive vaccination. 6 months old is the recommended age to start receiving the vaccine, and it takes 2 weeks to develop antibodies. There were 3 million doses were given in 2019 to 2019, and usually we use the trivalent or quadrivalent vaccines. Here's the natural history of flu. It starts usually November up to February. Influenza B, then followed by influenza A. Again, highest rates of mortality is still on 18 and below. And the mortality is usually associated with medical comorbidities such as hypertension, diabetes, immunosuppression, cancer, malnutrition. So let's go to the project background. Health fairs, this is pre-COVID era. This is joint venture project with multiple Lions and Leos Club of District 4C4, usually 6 to 10 clubs joining together. This is called a multi-club joint project, usually done, we did this for the last 10 years, usually October to January, and we do it weekly to bi-weekly with 10 to 16 locations per year. The locations are churches, city hall, and other public places. Service provided, we provided vision screening, diabetes screening, cardiovascular disease screening, hepatitis B screening, flu shots, etc. So these are to show you pictures. Blood cholesterol testing, blood glucose, take note. The poster on the right side, that's a friend of Dr. Eleanor Britter. That is Dr. Oz, a supporter of Global Initiative for Health and Wellness. So he's in that picture, he gives a lot of funds for this program. And you have seen the picture of that PDG Esther. And they got flu shot and blood glucose determination. Hepatitis B screening. Take note, hepatitis B screening. 3 days ago, I inducted a new lion in Silicon Valley Cyber Lions Club. Her name is Fiona Ma. Fiona Ma is the California State Treasurer, so he's member of one of our clubs. And he's very passionate with hepatitis B. In fact, this is one of her advocacies because Fiona Ma has hepatitis B.
Yes.
And the Asians, immigrants, has the highest rate of hepatitis B. In fact, they have the highest rate of liver cancer because hepatitis B becomes a liver cancer in 40%. So this is a very good program. And we partnered with our Leo Club. The Leo Club had their own literacy project. They provided free books to children. These free books were donated by the San Francisco Public Library, and we sent tens of thousands of children's books to the Philippines, distributed to various elementary schools and high schools. Okay, so we also partnered with other non-government organizations, the Second Food Harvest. You can see Dr. Britta there. So we have cardiovascular screening, nutrition, wellness. Other services we have provided, we have chiropractic, we have also breast cancer screening, So these are our Leos during that time. They are now Leo Lions.
That's good. They grew up. Yeah.
Medical consultations and other services. What happened during COVID-19? So this is started on March 20 when shelter in place, social distancing, local and state guidelines, CDC guidelines and LCR guidelines. So it changes a lot of things. The way we conduct business, the way we serve our communities, the way we conduct meetings. This is now during COVID-19 pandemic. So, however, we are lions because, well, there is a need, there is a lion. So we serve, and we serve safely. So LCI, in fact, provided us 100 ways to serve COVID-19 during COVID-19 pandemic. For us, doing these health fairs for the last 10 years, we had to innovate, we had to reinvent to the needs of our community.
Are they there?
That's why we have now this Drive Thru Clinics. We have planning committees, Leo Lions partnership with non-government organizations and government. We have logistics, implementation, data and data analysis. Planning strategy took us 3 to 4 months. All plans should adhere to the CDC, World Health Organization, should also adhere with these LCI guidelines, federal and state laws, and safety of all lion and non-lion volunteers as well as the public is paramount to the success of this project. We have developed different committees, the executive committee, committee on volunteers, committee on logistics, committee on immunization, medical, website technology, food, beverages for the volunteers, security traffic, data collection, marketing, social media support. So it's not just a simple project. It took us a lot of talents, time, resources planning this. So we have also the Leo Lions and Club partnership. I think we have nine clubs and Leo's clubs partnering. Smaller clubs, bigger club. So it's a matter of joining together. Other partners, we have our District 4C4 Healthcare Committee and the Global Initiative for Health and Wellness. During that time, we are in the process of endorsing this as a district project, which happened, and now it is now an MD4 endorsed project. It's also the Samaritan House of San Mateo, which is a non-profit organization providing a lot of services to San Mateo, and of course, San Mateo County Department of Immunization Program. So we have logistical support, San Mateo Department of Immunization Program that provides us the flu shots and supplies. The Samaritan House provides us the site location. The Global Initiative for Health and Wellness provides us the supplies and healthcare professionals. The Lions Club provides us volunteers, food, beverages, etc. So, procedure. We have online registration. The volunteer as well as the patient can go online and they can select what is their job, what is the requirements, the days of shift for volunteers. For the patient, they can always register what time they're going, how many patients they're going, and all these informations are also provided to them online. They can even print necessary paperwork. So we created a website. We have a very strong marketing technology team. So we created the online registration, and it tells you already if there's a spot for a certain period of time. That includes the volunteers as well as the patient. So this is an example of our online patient registration. And the process. The process is, it takes only 20 minutes. patients remain inside the car. We follow the CDC and World Health Organization guidelines such as wearing masks, applying antiseptics. Volunteers also follow the same guidelines, and we adhere to online appointment, but time walk-in is accepted on a specified time. On station 1, we call it the COVID-19 screening, wherein no touch temperature taken, COVID-19 exposure screening, and signs and symptoms questionnaire. So this is an example of the questionnaire, and we have 6 languages provided to the patient. On station 2 is the registration. Volunteers verify the registration and appointment as well as screening checklist and consent. So this is some of the things that they need to fill it up. Contraindication checklist waiver as well as DC waiver for liabilities. Station 3 is the vaccination process. Upon verification of the screening checklist and consent, the vaccine is administered by a licensed healthcare professional. After that, they will provide a flu vaccine card, which is like this. Station 4 is the post-immunization observation. Car is parked in a designated area. They are observed for 15 minutes for any adverse reaction. After 15 minutes without adverse reaction, then they are free to go. However, during that time, they are also asked if they want to receive services provided by the Global Initiative for Health and Wellness, because we maintain a separate clinic. So this is a short film.
Volunteering here today to Drive Thru Clinics with Lions Club.
A lot of people have been coming in. Yeah, the turnout's been pretty good.
This time of COVID-19 pandemic, where everything changes, even the way we serve our community. Previously, we do health fairs in different locations in San Mateo County.
We go to churches all across San Mateo County, and now just due to safety, we've had to stay here and have everyone come to us with their cars. So it's different, but it's working, and we're just doing the best we can.
Following CDC guidelines, World Health Organization guidelines, and local health department guidelines because of COVID-19 pandemic. We serve our community safely.
We're doing our free flu clinic today. We give away all of our medical services, dental services, and we want you to join us in this.
You know what happened? There should be a film in here.
Censored. It's a short film.
It became very short.
Shorter than his head.
So this is our results. On 2021, we provided with 1,200 flu shot vaccine, and we have an updated. You know what happened after the when the COVID vaccine was available? This converted to flu shot, drive-through flu shot, and drive-through COVID vaccine clinic. Then later on, when the clinics are open, we can see face to face. This became we still provided the flu shot and COVID-19. In fact, Dr. Eleanor Breeder continuously do this project in our clinic. So we provided 2,000 flu shots and COVID-19 is 200, but this is only the initial. I'm pretty sure this is much, the data is much higher. So we have a government reporting, so we are required by law, patient demographics and vaccine usage is reported in San Mateo County Department of Immunization Program. And the data collection and analysis, demographics of patients will give us better understanding on the needs of our community so that we can plan to improve our services in the future, and this will help us also for future grants application. Every day we collected feedback. Key lions and committee discussed the day's activities to improve existing procedures or protocols, and feedback was also requested from the patient to better serve the community, and feedback of volunteers throughout the day gave the volunteers a better experience serving the community and promoting camaraderie among lions. So the positive outcome in relation to the COVID-19 pandemic. So during that time, the San Mateo County Immunization Program coordinated with us, and they requested us to follow our protocols, and it became the template of the San Mateo County COVID-19 Drive Thru flu shot. So, and they provided tens of thousands of COVID-19. So we were the one to create the protocol. So again, these are just acknowledgements of different committees and different organizations. And also this is acknowledgement of different LEOs and clubs. And we get the second part of the presentation